Hi, my name's Spurr and I'm Edelman's Group Managing Director of Health here in London. And one of the key things that I found really interesting about this year's Edelman Health Barometer was the data set on health behaviour change. Health behaviour change is well documented in academic theory as something that is very difficult to actually sustain, and we wanted to understand why the public thought that was. They're very much motivated for the right reasons, as theory would suggest. They want to give up bad health behaviours such as not exercising enough or a bad diet or smoking because they want to be healthier in the long term. They want to be around for their friends and family. But when we did some analyses of our data and regression analyses and understanding different cuts of why people genuinely didn't maintain health behaviour changes, we found some really interesting themes. The three themes are all really around instant and immediate gratification. One, they don't see the feedback quick enough, i.e. they're not necessarily seeing their progress and they don't think that the changes are really working. Two, that the new behaviour is actually not as enjoyable as the old behaviour, which is a big problem for many people. And number three, that they actually feel trapped in some sort of dependency on the bad behaviour. They don't know how to escape. And I think the really interesting thing is about the first two of those things. Business can really help these people make those changes and potentially even sustain those changes, because things like games and apps and more enjoyable ways of making people healthier, which are on the market today, really do potentially have an impact on improving health behaviours for the longer term. In fact, in our data set, we asked people were they using them. And we found about 20% of people are using apps and games in this way. And the really interesting thing is when we looked at this type of people, when we looked at the identifiers and markers of this 20%, they were healthier than the rest of the population, they were more successful in maintaining health behaviour changes, they were much less likely to regress and have a relapse on a bad health behaviour change, and they're also much more willing to share health information with others. And what I think is really interesting about this for business is if we can spread these types of apps and help people communicate more about their health, there's a real chance that we can change many more people's lives and make this health behaviour change more permanent.